Welcome to the press briefing. With us are Dr. Albert Au, Principal Medical and Health Officer of the Communicable Disease Branch of the Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager from Hospital Authority. The doctors will give us an update of the situation. Dr. Lau. Good afternoon. I'd like to brief you on the situation with HA. With 1,904 confirmed patients hospitalized, 266 are newly confirmed patients. For those who require isolation facilities, we have 1,271. Among them, 501 and 3 are in isolation ward, 120 odd are in second tier isolation ward, and 613 in infection control center of Northland Hospital. 213 of them are new patients. 7 more cases were reported in critical condition, 6 in serious condition. For confirmed inpatients, 40 of them are in critical condition and 27 in serious condition. 12 of the critical patients are receiving ICU treatment. For those who passed away, we have newly reported 5 cases of death. 1 male, 4 female, aged between 55 and 99. These 5 patients did not have 3 doses, and 1 had never been vaccinated. I will outline the 5 cases to you. The first, an 89-year-old male living with his family. He had 2 shots of vaccine. This elderly man had chronic diseases, hypertension, history of stroke, and some problem with his heart, and also enlarged prostate gland. He had a history of cancer, but that was more than 10 years ago. On the 17th of August, he attended the A&E department of Queen Elizabeth Hospital. He told staff that he had coughing for a few days, and he felt weak and was unable to walk. And he had fever recorded while on the ambulance. In the last 2 days, he had weakness of limbs, and the RAT result was positive. And CT value of PCR was 16.9, rather low. And he was immediately admitted to a medical ward. He attended the A&E on the 17th, but unfortunately passed away on the 18th in the evening. Another is a 99-year-old female living with a helper. She has had 2 shots of vaccine. The elderly lady had poor renal functions, and she had removed 1 kidney and also had a surgery on her stomach. On the 17th, there was a sore ulcer on her leg, and he attended the A&E department. She was admitted to the orthopedics ward. Admission screening found that she was positive by PCR, 38.6 CT value, and she was transferred to a medical ward. There, X-ray, a chest X-ray was done, and her right lung was found to be opaque. Another PCR yielded a CT value of 33. She attended A&E on the 17th, and PCR done on the 18th and 19th. She had a cardio arrest. Resuscitation was performed, but unfortunately, she passed away in the morning of the 19th. The third case, a 55-year-old female living with family with 2 shots of vaccine. The lady had terminal cancer in her colon, and then it has metastasized to her lymph nodes and also liver and lungs. She was tested positive by PCR. We had no record of her consultation at our GOPC or any medication. her condition continued to deteriorate. On the 18th, she attended our A&E department, where she told the doctor that she had been feeling unwell for the past few days. She had shortness of breath. She measured her oxygen level, but it was as low as 70%. So immediately admitted her to our medical ward. A PCR was done. The CT value was 21. Unfortunately, she continued to deteriorate, and yesterday, on the 19th, she passed away. The fourth case is a 19-year-old female living with her family with 2 shots of vaccine with various chronic illnesses, including hypertension, coronary heart disease, and also a heart failure, a history of stroke. She had skin cancer and also arrhythmia and also dementia. On the 11th of August, she attended our in the department for shortness of breath, and then her blood glucose level was low, and RAT tested negative. She was admitted to a medical ward. A PCR test yielded a CT value of 16.7. She was recorded. She was given oral COVID drug, and then Remdesivir was given. Another PCR was done again. The CT value was 21, and she passed away yesterday, unfortunately. The last case is an 84-year-old female living with her family. She had no vaccination at all. She had hypertension, hyperlipidemia, and also coronary heart disease. On the 30th of July, she attended our A&E department because of weakness on the left side of her body. RAT tested positive. CT value 20 by PCR. She was admitted to the internal medicine department, and chest X-ray found that her right lung was opaque, and then EEG found that she had a stroke, and then there was thrombosis in her heart. Well, because her lungs were opaque, and then and because of COVID positive, she was given oral antiviral drug, and then her CT value fell to 34. But due to various reasons, because of stroke and also thrombosis, she passed away on the 19th. Now, in these cases, one has never been vaccinated. Although antiviral drug was prescribed, although the viral load had fallen, but then without any vaccination, the risk of serious conditions and fertility can be 60 odd times higher. So again, I appeal to those who have yet to be vaccinated to receive the vaccine. Even if you have received 2 shots, the protection is not sufficient. You need at least 3 shots. And for those who are elderly and also with underlying diseases, 4 jabs are needed. Some patients have got symptoms. They tested positive through RAT. They did not seek treatment. I'm talking about the elderly and those who are chronically ill and who have cancer as well. So if you're over 60, if you test positive by RAT, and even though you may be younger than 60, if you have high risk factors, including cancer, then you should see a doctor as soon as possible to start oral antiviral drugs to suppress the reproduction of virus, to lower the possibility of death or serious conditions. All right.
We have 265 recovered patients, and 115 of them have been discharged. And 4 patients were identified or tested positive, and 4 patients in the same room were identified as close contacts. So 77 staff members were positive, and 22 staff have returned to their posts And that concludes my presentation. Thank you, Dr. Lau. I will now report yesterday's 19th of August latest data. Yesterday, local infection cases were 6,210. 2,900 were tested by RIT, and 4,117 were confirmed after PCR. And on the other hand, yesterday we had 179 imported cases, and 149 were tested positive by RAT, and the remainder of tested by RAT. The death figures, we had 5 deaths yesterday, and up till now in the 5th wave, Hong Kong has recorded 9,389 cases, deaths that is, and the 179 imported cases, 60 of them were found at the airport, and some 57 were also identified at the quarantine hotels or quarantine centers. The remaining 60 cases were identified at the community centers, and 62 cases were identified in the 4th to 7th day, and the remaining cases were identified after the 7th day. So the CT values were very high in these cases, and we believe they were reinfected cases. For all the imported cases, these cases came from 45 countries, and 4 countries had imported more than 10 cases. They include UK 20 cases, Philippines 17, US 17, and India 12 cases. The remaining 41 countries had imported 10 or less cases. At the RCH, we had 5 residential care homes that have new cases, 2 elderly homes involving 4 patients and 1 staff, and 3 care homes for physically disabled, where we had 3 patients and 3 staff. So these have 17 staff were identified as close contacts and need to be quarantined. So these 5 RCH include Tai Po, Fu Hang, and where they have 3 patients and 1 staff member. In Yuen Long, Gong On elderly home, 1 patient was positive. In Kwai Chung, the Salvation Army, like Gengyun, 1 staff tested positive. And in the Southern District, Tonghua Hospital, Jockey Club, Ai Bok Home, 1 patient and 1 staff member were tested positive. And lastly, in Sam Shui Po, the Pentecostal Yangzhan Community Care, Yu Choi, 1 patient was positive. In the last 7 days, the accumulated cases, we had 47 RCH where there were cases, and 34 of them were residential care home for the elderly, and a total of 94 cases. 70 of them were patients, and 24 were staff members. Today, it's a school holiday. There are no cases from schools, and yesterday afternoon we received a report from a school, and we found that there were some congregation, and the classes involved should be suspended. They are in Kowloon City, York International Kindergarten, K2, K2L2, Queen's afternoon session, and the 28 students, 3 students and 1 teacher were positive. So we recommend this class be suspended. Regarding the mutated strains, the laboratory testing L452R, that's BA5, the percentage has increased to 30.2%. On the other hand, BA.2.12.1, the percentage was 7.9%, and that concludes my report. Please identify your media outlet before you raise questions. The lady in front. The first question, the daily cases are increasing, but some members of the public are hiding their infection status, and we've had increases from 4,000 cases to some 6,000 odd cases. So have you projected what the future trend is and when will we surpass 10,000. And if it does surpass that, what measures do we have? And for the HA next week, there were 200 beds at the AWE will be commissioned again. So what measures do you have? Thank you for the question. Looking at the trend, we have considered some indicators, that is the daily infection rate and the RAT-PCR figures. We also look at the admission to hospital, those who need to quarantine, and the number of deaths. Thirdly, we also have to look at other indicators such as the community center sample percentage, the number of quarantine and sewage and also we have to look at the Hong Kong U data. So all these indicators, they have been on an increasing trend, and at the end of July, beginning of August, it had slowed down a bit, but we see in the last few days it's picking up pace, and every day compared to the previous day, we have an increase of a few hundred. So for 2 consecutive days, we have exceeded 6,000 cases, and we feel that if this trend continues, it will continue to increase. Regarding sewage testing, in the latest reports, the per capita level of we have a high since March, and these are community data, and it indicates that it is increasing. So this trend, we foresee that it will continue in the near future, and the government is now adopting a precise approach. We have new measures recently, including in mid-July, we require all infected persons to wear wristbands, and they should not leave their home quarantine address. We've also had the red alert requiring all infected people to not enter high-risk venues. So these measures will help prevent a further spread of the disease. And in recent days, we have stepped up mandatory testing. So if there are a large number of cases in certain buildings, we will have mandatory testing. Regarding next week's resumption of AWE receiving patients, we will provide 200 beds, and we have different facilities in AWE to take care of patients, including low volume oxygen machines. We'll have x-ray machines. We also have different medical staff and dedicated staff, including we will definitely have nurses and doctors. We have physiotherapists to help with rehabilitation. AWE also has TCM. We've always had TCM, that is traditional Chinese medicine services. So we serve a large variety of patients. Patients with dialysis needs might have to return to hospital for treatment. Overall speaking, we see some 80% of patients in the HA system are above 60 years old. So the AWA patients will tend to be older. The younger patients, or those who don't have serious complications, they might be treated in community centers or at home. So those who need hospital services, who need services at AWE, or they might be elderly, and we hope that with the resumption of AWE, we can relieve some of hospitals' pressure, and we can increase the number of beds to treat patients in hospitals. The gentleman at the back. Cable TV. Regarding the trends, we see BA5, it's now at 30.2%. So does CHP feel that this is alarming because BA5 is more transmissible and it might be the mainstream mutation? So will we be seeing a geometric increase in the infected cases? Is it a matter of concern? Will the transmission speed up?
The second question relates to the cases of death. The CT value of some of them were rather low. Does CHA think that the deaths are directly related to COVID? Thank you very much for your question. The first is about the trend of confirmed cases. Now, for samples collected of local cases, after they are sent to a public health laboratory, genome analysis would be done. The percentage of BA5 samples have been rising, and that is somehow expected because BA5 are more transmissible than BA.2, 12.1, and other subvariants of Omicron. So we expect this sublineage to be more prevalent in the community. And that's one of the reasons why the number of cases are rising further. We expect that in the near future, we will have a high percentage of BA5 cases, and that will cause cases to grow further. This mirrors the trend in other countries when the percentage of BA5 cases exceed a certain level, then the rise can be very sharp, and very soon it will replace other sublineages to be the mainstream in Hong Kong. We expect the same for Hong Kong. As for community transmission, it depends on the vaccination rate of the community, the immunity, and also the hybrid immunity of the community. Well, it's been over 3 months since we had the peak of the fifth wave, and for many of the confirmed cases, then if they have not been fully vaccinated, then the risk of reinfection can be high. So we are worried that as we enter into winter, there will be another wave of outbreak. So I appeal to the public. If you are not fully vaccinated, you must take this opportunity to be fully vaccinated so that when we have another surge in the number of cases, then you will be sufficiently protected. Even if you're infected, your chance of hospitalization or developing complications or even death would be lower. This is particularly so for the elderly. And if you have symptoms, you should conduct a test as soon as possible. And if you test positive, you should report to us as soon as possible. Whether you are tested positive by PCR or RAT, you should report to us in the first instance. We will pass your information to the hospital authority at once, and their staff will contact you to arrange the suitable treatment for you, including prescription of oral drugs. Now, for those cases who passed away yesterday, some of them might not be directly related to COVID-19. For instance, the 84-year-old female, when she was admitted, she was diagnosed to have a stroke and also myocardial infarction. So for these two conditions, the chance of death is higher. And then we have another case with colorectal cancer, and it has metastasized. So judging from the information I have, the case might more likely to have passed away because of the cancer. And there is another lady, 99 years old, with various underlying diseases. She had one kidney removed. Her renal function was poor. When admitted, her CT value was not high. It was just 36 or 33. and she had antibodies found in her body. Suddenly, there was a cardiac arrest, and we have to find out the reasons. We cannot confirm her cause of death now, but it doesn't seem likely to be due to COVID. And then for other cases, they were not very directly related to COVID. Thank you. Next, the lady in the back row. Good afternoon. I'm from Mingpao. Now, for 2 days in a row, for those with amber code and picked up during day 4 to day 7, the percentage has been over 29% higher than the original projection of the government. I'd like to know the reason for that, and will more measures be taken to lower the risk and lower the percentage? Because if the trend continues, what will be the impact on our situation? And Dr. Au said that different indicators can be used to gauge the situation. For RT from Hong Kong U is 1.2, and then viral load in sewage is also rising. Will you consider measures such as some tightening of social distancing measures to control the situation? And yesterday, 2 staff members were tested positive using RAT in a care home, and they only required to have 2 PCR tests in a week. Does that mean that the requirements is not enough? And it's been suggested that these staff should at least have 2 PCR tests per week. And HA said that croup is a serious case requiring ICU treatment. I'd like to know whether serious cases have not been reported or announced, or will you improve on this arrangement? First, on imported cases. Since the introduction of the amber code measure, well, it's just for a while, and we need more time to collect more data for analysis. Back then, 7 days of quarantine and hotel was required, and the situation right now is not very different from back then. Over 90% of the cases have been found within 7 days, and for cases identified after 7 days, most of them are repositive cases. For cases picked up within 7 days, usually they were picked up at the airport or during the first 3 days of quarantine. And of course, there are bound to be fluctuations from day to day. Now, for cases picked up from days 4 to 7 at community testing centers, now we have reviewed the CT value. At least 27 cases have a CT value of over 30. So these cases might be infection before we return to Hong Kong, and these are cases of repositive. For cases picked up in between the 4th and the 7th day, they might be repositive cases as well. So we will have to collect more data for a detailed analysis. We will also monitor the percentage of positive cases for those who have completed the hotel quarantine and taken on day 4, day 6, and day 9. And in the recent few days, the effective RT, according to Hong Kong U, has risen to 1.2%. It was once less than 1 for a while, but then is now risen to over 1. And the same applies to sewage samples. Sewage samples collected at different districts has viral load risen to a rather high level since March. So we will enhance our testing capacity and frequency so the cases can be identified earlier. So we appeal to people who engage in high-risk jobs, such as those working in care homes, in schools, and in hospitals. Perhaps they might want to consider doing regular PCR tests. Teachers are required to do RAT before going to school, and the same for students. The purpose is to identify asymptomatic and also hidden cases as soon as possible to prevent another massive transmission in the community.
Regarding the residential homes, the patients, if they're infected and if there are complications and deaths, the risk of death is high. The vaccination rate is also not very high. So we hope that to prevent any outbreak in residential care homes, when there are cases in RCHs, we will conduct epidemiological studies and arrange close contacts for testing. Staff also need regular testing, regular PCR testing. We now require RCH staff to conduct PCR tests once a week because it is more sensitive than RATs, and we've seen PCR testing positive and the RAT can be negative, so maybe it's not as sensitive. So having PCR testing at the same time will help us detect and prevent spread of disease. So labor and welfare are looking into how they can fine-tune arrangements. Now, for children who have croup cases, the number has been going up. Some children, after being infected by COVID, the parents see they have difficulty in breathing. They are taken to hospital and they are diagnosed with croup, and if they are detected early, the early medication can relieve their bronchial inflammation and they can recover very quickly. And that's why we have reminded parents, if you see your children having difficulty in breathing, shortness of breath, they have muscle fatigue, or if you hear rattling in lungs, you need to see a doctor as soon as possible and receive medication. For severe croup cases, that is because maybe parents did not detect it early or the complications arose very quickly. They might need intubation, they might need to be treated in the intensive care units for children. So all these will be reported. We will report serious and critical cases. For mild cases, each hospital has records. They will have data on the number of cases. But it's important for us to detect an increase of cases. In the past, we might have only a few cases per year, but now we have a few cases per week. So why are pediatric doctors so concerned? We need to inform the public that this could lead to croup, and if you receive early intervention, you can recover fully. But if you are diagnosed late, there might be serious complications such as oxygen deprivation in the brain and so on. So with more public information, public are more aware, and we can hope to reduce the serious complications. Let's take the last question. TVB, first of all, regarding the trends, Dr. Ao said that there have been measures to stop the trend, but we have been unlucky in being able to cap the number of figures. So will we see 10,000 cases or 20,000 cases before we see tightening of measures? Second, you referred to a kindergarten in Kowloon City. Is it in Kowloon Tong, York Road, or Cameron Road? We see that there are a lot of number of cases there. Is it student transmission or transmission from teachers to students, or is there contamination in the kindergarten? Thank you for the question. The first we had answered just now. We see currently and last few days the number of cases has risen quickly. That might be foreseeable because an uptick in BA5 cases. There might be other reasons, such as the public resuming normal activities. There might be more human-to-human contact in the community. We will be keeping a close eye on the trend and will decide on the next steps. The government, our health and medical colleagues will be looking into measures that can be adopted. But we also want to focus on high-risk groups, high-risk venues. We want to prevent complications and death, including RCH, schools. We are monitoring on a daily basis the number of cases from residential care homes. We take immediate action, including epidemiological studies, close contact tracking, and also identifying close contacts and so on. The government is taking a focused approach. We examine the data. We want to strengthen areas that need strengthening. So we don't want to take a blind approach that affects the public. We have the red alert. We have wristbands that can reduce community spread. We will also observe the trends. For example, yesterday, Security Bureau resumed the Kai-Tak Community Center. That is, if we have further increases in cases, we'll have sufficient quarantine facilities. And your other question was about York International Kindergarten. I might have not made it clear just now. In one class, there were 28 students, and 3 students and 1 teacher was infected. The address is Kowloon Kimberley Road. That concludes today's press briefing. Thank you.